Over the next 30 years, the number of people living with dementia in Canada is expected to triple, according to a 2020 study by the Alzheimer's Society. Now, new data released by the organization shows that by 2050, 1 in 4 people in Canada who develop dementia will be of Asian origin.
It relates back to the number one risk factor for dementia, which is aging.
Dr. Joshua Armstrong, the lead author of the study titled The Many Faces of Dementia in Canada, explains that the data does not indicate that people of Asian descent are at a higher risk for developing dementia because of their ethnicity.
Asian populations are actually a bit of lower risk compared to other ethnicities, but just because of the demographic makeup of the Asian population in Canada, we expect to see those numbers increasing drastically. Those individuals that came over in the 70s, 80s, and 90s are now getting older, over the age of 65, and with that increased age comes increased risk for dementia.
The study also has a separate chapter dedicated to Indigenous people in Canada, with an expected 273% increase in people living with dementia by 2050 in that population.
I think when we're thinking about population health for Indigenous populations in Canada, we have to talk about the impact of colonialism and how that impacts all aspects of health, the determinants of health.
One of the points covered in the study is the stress generated by facing racism, which contributes to such high projected numbers.
Chronic daily stress from things like racism can have a negative impact on the brain. And that negative impact on the brain over a life course can really lead to some negative health outcomes, including dementia.
He adds that this is also true for other populations with similar risk factors.
I think really important to not just focus on those individual factors, those things that individuals can control, but also think about how our society is organized and how it influences health outcomes across all populations in Canada.
In addition, Armstrong adds that the study looks at diverse characteristics and shared differences to better understand the needs of different groups, so that services can be adjusted and optimized to meet those differing needs. However, a one-size-fits-all approach doesn't work when it comes to dementia.
There's a famous quote within the report that we share. It's, if you've met one person living with dementia, then you've met one person living with dementia. Everyone's unique. So when we're looking at trying to support someone living with dementia, really recognize that that's an individual, that the person has a story, and try to address that individual in a person-centered way and address their needs, no matter what characteristics we're talking about. How can we tailor our supports to fit their needs?
Dilshad Burman, City News.